If you want to learn how vitamin D supplementation affects stress and anxiety, then this video is for you. Here's what you can expect to learn. First, we'll address whether vitamin D supplementation helps with stress and anxiety, both in people who have clinical anxiety and depression and those that don't. Then, we'll look at what effect does vitamin D supplementation have on cortisol levels, that is the stress hormone. Then, we'll talk about 7 causes of vitamin D deficiency. 6 of those 7 causes have nothing to do with not being out in the sun. Then we'll discuss 4 other supplements for anxiety besides vitamin D. Before we jump in, who am I? My name is Igor. I've been a personal trainer since 2006, and I've been training other personal trainers in my methodology by speaking at some of the world's largest personal training conferences since 2013. As well, I've delivered over 400 wellness presentations to some of Canada's largest corporations, including IBM, Bosch, American Express, University of Toronto, Investors Group, and others. Additionally, I'm the author of the book, The Mental Health Prescription, and if you want to buy it on Amazon, the link is in the description below. If you want to learn when I publish more videos about vitamin D as well as mental health, click like and subscribe to my channel. So let's jump in. Does vitamin D supplementation help with stress and anxiety? Let's look at what the research has to say. Here's one study titled Effect of Vitamin D Supplementation on Depressive Symptoms and Psychological Well-Being in Healthy Adult Women. And again, I want to emphasize these are healthy adult women. They do not have clinical depression. So group 1 was given vitamin D injections of 50,000 IUs once per month for 6 months. Group 2 was the placebo group. Now, if you're wondering, why were they given injections as opposed to supplementing with it? It's because when you tell people to supplement with it, there is the issue of compliance. Will they do it? Will they do it 4 days out of 7? Will they do it 7 days out of 7? Will they use the right dose, etc.? Whereas when it's injected, it's very, very standardized. They know the dose, they know the frequency. So here were the results. The depressive rating increased actually from 13.1 to 13.6. So their depression actually worsened a little bit. Their anxiety rating also worsened a little bit from 13 to 13.4. And their flourishing rating decreased from 45.3 to 44.7. So not good. Positive mood was unchanged and negative mood was unchanged. So overall, there wasn't much of a difference, if anything, a slightly negative difference between vitamin D supplementation and not supplementing with it in people who don't have clinical depression. Now, here's another study titled Annual High-Dose Vitamin D3 and Mental Well-Being. In this study, they got 2,317 women over the age of 70. And again, group 1 received vitamin D injections, group 2 received a placebo. Here were the results at the end. Their mental health was unchanged with vitamin D supplementation. So we know that in people who don't have clinical anxiety or depression, vitamin D supplementation doesn't really do anything. So that's what we know. Now, what about people who do have existing anxiety or depression? In those people, the research is actually fairly mixed. Here's why. Here's one meta-analysis titled The Effect of Vitamin D Supplement on Negative Emotions. And the results were, again, mixed. Some people who have anxiety and depression benefit from vitamin D supplementation and others don't. So what is it that differentiates those who benefit from those who don't? Can you predict who's going to benefit ahead of time? Yes, you can. Patients with major depressive disorder and individuals with vitamin D deficiency are most likely to benefit from supplementation. In other words, if your vitamin D levels are low and you bring them up to normal, that helps a lot. To go from normal to excessive doesn't help at all, and sometimes worsens things. Here's another study titled The Relationship Between Serum Vitamin D Levels, C-reactive protein, and Anxiety Symptoms. If you're wondering what is C-reactive protein, it is a measure of inflammation. And here were the results. When people had good vitamin D levels, as seen in blood work as 20 nanograms per milliliter or more, there was no association between anxiety and vitamin D levels. However, when people's vitamin D status was low, they had less than 20 nanograms per milliliter of vitamin D, they actually had an association between anxiety and vitamin D levels. Now, here's another meta-analysis titled The Effect of Vitamin D Supplementation on Depressive Symptoms in Adults. Here were the results. Vitamin D supplementation had mild to moderate effects in people who had major depressive disorder. However, it didn't work without it. In other words, people who just had stress, vitamin D supplementation didn't reduce their stress. People who had mild to moderate depression, vitamin D supplementation didn't work, only in major depressive disorder. There are some other interesting findings in that meta-analysis, and that is that women who are between 6 months pregnant up to 6 months postpartum, they actually had significant reductions in their depression if they had it to begin with. If they didn't have depression, then vitamin D supplementation didn't do anything for them. Also, in people suffering from SAD, seasonal affective disorder, vitamin D supplementation didn't work. How interesting that that is actually one of the most common uses of vitamin D. And yet, according to this meta-analysis, it didn't work. But again, I predict that it probably would have worked if they had low vitamin D levels to begin with. Next, let's look at whether vitamin D levels, vitamin D supplementation lowers cortisol. If cortisol is a stress hormone, does vitamin D lower the stress hormone, and therefore does it lower stress? Well, if we're looking at it directly for stress, we know it doesn't. But what does it do anything to cortisol? Let's look at that. Here's a study titled Effects of Vitamin D Supplementation for 12 weeks on serum levels of anabolic hormones, that is muscle-building hormones like testosterone, anaerobic power, and aerobic performance in active male subjects. Here were the results. Vitamin D supplementation reduced cortisol levels only in vitamin D deficient individuals. The message again is clear. It's what I've been repeating in all of my videos about vitamin D. To go from deficient to sufficient is very beneficial. Sufficient to excessive doesn't do anything and sometimes does outright harm. So it's not a case of more is better. It's a case of the right amount of vitamin D. You hear in the news and even YouTubers say everybody's deficient, so try and get it up. Well, no, not everybody's deficient. There's lots of people who are not deficient for reasons that I go into other videos. Here are the causes of vitamin D deficiency. Most of the time, people tell you you're deficient in vitamin D because you live north of Los Angeles, so you just don't get enough sun most times in the year. And that is correct. However, there are 6 other reasons why somebody might be vitamin D deficient while they're still getting adequate sunlight. Another possible reason is that with the sunlight you are getting, you're blocking it with sunscreen. Another possible reason is that you're having kidney problems and liver problems. Both the liver and the kidney are used to synthesize vitamin D. You need a combination of healthy skin, healthy kidney, healthy liver, and well, a bunch of the other factors. In addition to that, physical inactivity, just being inactive and sedentary, that prevents your vitamin D levels from being normal. Exercise alone with no vitamin D supplementation raises vitamin D levels. Another possible reason for vitamin D deficiency is also magnesium deficiency. In studies where people who are deficient in both vitamin D and magnesium, they supplement with magnesium, their vitamin D levels go up. How interesting is that? And another possible reason for vitamin D deficiencies while getting adequate sunlight is active inflammation. When inflammation is high, vitamin D levels are low. When inflammation is resolved, vitamin D levels rise by themselves without outright vitamin D supplementation. Now, besides vitamin D, there are other supplements for anxiety that have way more proof behind them, like magnesium, B complex, ashwagandha, and kava. If you want me to elaborate on any of these, just comment below with which supplement you'd like me to create a video about, and I'll do so. Again, if you want to learn way more about mental health, check out my book, The Mental Health Prescription, on Amazon, which is in the description below.